You're with me, Clive Holland, from Fix Radio, the Builder Station, for a special podcast. Now, as we look to address health issues in the construction industry and understand how we can best look after our bodies, mine's not been very well looked after, as you can tell, as well as issues around asbestosis, given how high a risk we are in the industry and very vulnerable to it, tradespeople are. With me in the studio today is a very, very famous doctor. Right, you've seen her regularly on your TV. It's a doctor you'll recognise, as I say. And she's also brilliant on the social media as well. Just check her out. Ladies and gentlemen, please put your hands together and give it large for Dr. Helen Wall. Yay! Right. Doc,
Hello.
I'm calling this The Doctor Will See You Now.
Could be controversial,
yeah,
couldn't
could be, because the situation at the minute is, it's hard to see doctors, you know. We'll get into that in a second or two. But first of all, I want to set the seed of Dr. Helen Wall. How Dr. Helen Wall came about. Why did she want to become a doctor? Mm-hmm. And I'm going to ask the controversial question, are you happy with your job, with your choice of career? So tell us how it all began.
I wanted to be a doctor from when I can remember, really, from being 5 years old, I think. I was born to older parents at the time, and I had older grandparents, and I spent a lot of my childhood visiting care homes or in and out of hospital settings, care settings, and it just became a familiar environment. I just sort of watched other healthcare professionals, thought it was interesting. My mum was a midwife, quite a senior midwife at the time. Absolutely loved her job, was very passionate about it. But interestingly, wasn't keen on me going doing medicine. But I would say she was a little bit cautious about it. She was a bit worried, although obviously very proud. And unfortunately, she never got to see me graduate. She actually passed away about 8 weeks before I graduated. So
that's sad.
Yeah.
But she'd been in that environment, so she'd been in and around doctors. She knew the pressure that doctors and nurses were under. And I would imagine back then, nowhere near the pressure that they're under now and the scrutiny that they're under now. So it's a very difficult situation. So my next question would be that choice, right? Are you still happy with it? Do you still love seeing your patients? You can't love seeing all of them. I definitely know that. You've still got to put a smile on your face.
Yeah.
And of course, you're mixing with people that are ill all the time. So that's also
I've got
pretty
a cracking
tricky.
immune system, though. Never get ill. I think I just acquired it over the 20 years of being with patients. But am I happy? I think, if the question is, am I happy with seeing patients and the job? Absolutely. That will never grow old for me. I think the day that grows old is the day I have to leave medicine.
Yes.
Seeing patients, making a difference, being involved in patients' lives, it's an absolute privilege. As a GP, you actually get to be part of people's lives. It's not just, dealing with a problem and you never see them again. You almost, they grow up with you. I've got, in my practice now, I've got children who I remember being born and they're off to secondary school and some are going to university. And, I love that part of the job. But, there's bits of it that have become more and more challenging over time, and you kind of get a bit tired 20 years down the line. With any job, you get sort of a bit fatigued with things, don't you? And I think that the politics of it and the pressures and the way the NHS has changed in that time, it's
the
difficult.
Funding and everything else, it's all gone the way of the past. So but the thing is, without you guys, like doctors, nurses, emergency service people, where would we be? So I have to say, I know we used to do the applause and stuff like that, but over the COVID period, but you guys just do an amazing job. So we've got to thank you for that. And I know people don't understand at the minute because they want to try and see their doctor. I don't know the real reason behind why we can't see one anymore when we want to.
Yeah, I mean, that's a podcast in itself, isn't it? I think that's a whole, it's multifactorial, and I do talk quite a lot about that on my Insta page, because I think for a long time, we've not really spoken about the real reasons of why that is and what's really going on behind the scenes. And there are really core issues that we're dealing with on a day-to-day basis. People will say GPs are lazy, they're not seeing anyone. The demand it's more than it's ever been. We're working harder, longer hours for effectively less money than we ever have.
And you've got to live it to understand it, and those people don't. They don't. That's why they don't understand it. We're all in it now. Obviously, with Fixed Radio, we're all about the building and construction industry, and so we've got majority of our industry is obviously very macho, very male based.
Yeah,
we're getting more and more women involved, which is great.
Yeah,
and with men, as you will probably know, I mean, I don't know, maybe the 21st century now has sort of opened them up a bit more. They will talk as compared to, a few years ago, say. But they have issues. It's a very demanding job. And so they get aches and pains and strains and everything else.
Yeah.
Things that they maybe should be seeing their GP about, or at least consulting with somebody, they don't. Okay.
No,
so
and tradies are the worst for that. They absolutely are the worst. No, I tell a lie, actually. I think probably the only male worse than a tradesperson for coming with a problem in a timely fashion to the doctor is a farmer. Farmers and tradespeople tend to put things off. They just ignore it. They don't want to, and I get it. They don't want to take time off work. They don't want to miss out on money because many of them are self-employed, and they put things off and they keep going. But yeah, they often turn up in a worse for wear state for it.
Yeah, when it's probably at times too late as well.
Yeah,
it's just been ignored.
Absolutely.
So let's take some questions first of all, because we've compiled some questions from people.
Okay.
But one of the big issues in our industry is asbestos and the use of asbestos.
Yeah.
Now, it's not the use now because it's banned, but obviously it's still in a lot of buildings that were built during the 20s, the 30s, and even before that. And so you come into contact with it. Even when people in mechanicking industries, there were brake pads were full of it and whatever else.
Yeah.
My own father-in-law died from that, the same situation. But tell us, first of all, a little bit about asbestosis, how it affects people.
So asbestosis sort of breaks down into dust. So if you've ever worked with it, you'll notice that it gets quite dusty and there's particles. And those particles, first and foremost, we think of it as causing lung disease. So the asbestosis, it can get inside your lung. It starts causing scarring, starts forming thickened, what we call plaques around the lung edges. It makes them really stiff. So you struggle with your breathing. Your lungs are designed to inflate and deflate, and that's how they get air in and out, and that's how the air shifts around your body. And when your lungs become stiff because of the asbestos, which is effectively the particles going in to your lungs causing scar tissue, then you can't get that air in and out, and you start to feel short of breath. You start to get a cough because your lungs are trying to get rid of that dust, that scarring, and it leads to really quite serious lung disease. But it's not just asbestosis. Asbestos can lead to cancers as well, not just lung cancer, but skin cancer, cancer of the throat. So it's a really nasty substance. And I think the alarming thing for me when I was having a little bit of a read about this is the number of workmen and women who perhaps just don't recognise the dangers really and the risks around it, you know, and how serious it can be. And
because it just takes one particulate. A lot of these, like the blue, the white, the brown, have all got like little barbs on them. So if you inhale just one, it could lay dormant for 10 years.
And this is it. It could take 10, 20, 30 years before you come back to us with symptoms. It's by no means an instantaneous thing usually. But when you do come back with symptoms, there's very little we can do to improve the situation really. It is a downward trajectory, so it's better to prevent it, definitely.
We always talk on the show as well just how important it is, in terms of making sure that the professionals actually get rid of it, because even a lot of it was all bolted down. So even if you just take a spanner to it or an adjustable and you start undoing those nuts, just starts to break the edges, and it's in the atmosphere straight away. So you've got to be careful, and you've got to, of course, have the vital PPE to protect yourself from it. What are the early signs, though, Dr. Helen, to look out for if you think you might have it?
So I think a really key one here is about the persistence of the symptoms. So, we all get a cough, don't we, from time to time. And not all coughs are going to be asbestosis, even if you have been exposed to it and you know you've been exposed to it. And of course, many people won't. But if that cough is persistent, if you're persistently coughing, so a cough should last 3 weeks, an infectious cough. If it's last 3 weeks, we're not concerned at all. If it's going past the 3-week mark, then we'd start thinking about chest x-rays, sputum samples, or sending a bit of phlegm off to the lab to test. We'd start looking for other causes of that. So a cough that's going on for weeks and is not getting any better, we hear people putting it down to it's a smoker's cough, it's an allergy cough, or it's just a cough that's not gone. You need to get it checked really, because those are the people that come in and they start their cough. You say, how long have you had this cough for? And they say, months.
Yeah, 2
and you
years.
Think, oh my God, like this has gone too far. And then you start to feel breathless with it as well. So if you're doing your job and suddenly you can't do as much as you could before because you're getting breathless, again, people put it down, especially tradespeople, because they don't want to, take time off work. They'll put it down to, I've put a bit of weight on, I'm getting older, I'm tired. Just be alert, really, that, just get it checked.
Yeah.
Because the earlier we find it, the
better.
The better, really, with
I'll
anything.
guarantee you, somebody listening to you now, there'll be somebody listening to us now, and they will be going, do you know what?
Yeah, I'm sure there's more than.
I guarantee you. I'm just saying that if we can help just one person,
absolutely,
to go, do you know what?
Yeah.
I'm going to go and check this out, and I think it's really important to do that. So we put out some messages out to our audience to find out if they'll be brave enough to see the doctor. Now we've got a few health concerns. First of all, in terms of a carpenter called Jim, has said the aches he has in his knees and his back are horrendous. Is there any way that he can avoid them? And I know we talk about lifting in the right positions and stuff like that, but a lot of these guys are quite long in the tooth. They've been doing this job for ages, and they ignore these pains.
Yeah.
Again, what would your advice be for somebody like Jim?
Do you know, I meet a lot of trades, men and women, as a GP, and when you say to them, what do you do? Do you exercise? And they always say, oh, well, I've got a really manual job, so I don't need to. And I think that's a bit of a myth, really, because actually you might have a manual job, so you're getting your cardio exercise and all of that, but if you actually think about the movements you're doing in that job, it's probably repetitive movements, and that's what's causing the repetitive damage. So it's like repetitive strain injuries. You're probably doing the same few movements over and over again, whether it's lifting or putting things on your shoulder, reaching, kneeling. And that's all right, manual, but you're actually creating that repeated trauma. So what I would say is think about more general exercise to strengthen the muscles, because if you're using the same muscles again and again, you almost need to counterbalance that. So things like walking, people might laugh at this, but I'm going to say things like Pilates, yoga, balance, flexibility, strength training, all help to combat those constant overuse of the same muscles, because you're balancing it out. And I think I think people don't realise that. They just assume they've got a manual job, so forget about the rest.
It's interesting. One thing I would say is, if I got a load of the lads in here today, sorry girls, because I know you do the Pilates, but if I got a load of them in the studio and say, right, time for Pilates.
We have to trick them and say pie and lattes instead, and get them in on that.
That is a great shout. We'll have to do that. I'm not too sure that. I think there'd be a few expletives.
And I'm sure I would get, I have been laughed out the room as a GP.
It's a great idea
for saying it, but I think we need to normalise it a bit more.
For sure. People think it's too quirky.
Yeah.
But it's not.
No, it really improves your muscle flexibility, your core strength. All great for aches, generalised aches and pains.
Do you know what? There was a footballer called Ryan Giggs. I don't want to talk too much about him, but there's a footballer called Ryan Giggs who always did Pilates.
Yeah.
And the rest of the players were going, what are you doing that for? But look at his longevity. He played till he's 40.
Yeah.
So there's got to be something here. That's for sure. Right, so... Fire! Listen.
I think it's just a test, sorry.
All right.
Do you know what? The last time I was here, that happened.
Sorry,
they're announcing you here.
Well, good to have a break, relax.
Yeah.
You?
And away you go.
So it doesn't. Okay, so.
Pick it up and talk about buying gigs, if you will. That's all right.
Yeah. Okay. Yeah. from the Ryan Giggs bit.
So just if you could just pick it up from me played until he was 40.
Yeah, okay.
Is that all right?
Yeah, we'll do. Just tell me when you're ready. Great. And it must have worked for him because he played up until he was about 40. Yeah. So I think we need to bust this myth that it's not for the geezers. You know,
absolutely, yeah.
Because definitely. It is, definitely. I think if I was more flexible and younger, I would definitely be having a go.
Yeah, but maybe if you did Pilates, you would be more flexible.
Oh, think of the mess. Think of the mess on the floor when somebody's going, can you get up? No, but yeah, I think it's passed me by. But what I'm saying is that our young, the young people, you know, that are on site these days, if they're not doing it, they should. You know, I agree with you 100%.
Well, maybe start. I mean, for people like, was it who's just given that question in? You know,
yeah, Jim.
Your Jim. Maybe just start by doing a bit more walking. You know, just avoid the same movements again and again. Heat can help as well.
So there could be certain muscle groups that are just not getting exercised. The same muscles are getting exercised all the time, and the others are being left behind.
So they're getting bigger, and they're actually pulling on the ones that aren't being used. You know, you get imbalance, and then you start walking differently, and you're moving differently, and it's sort of all the mechanics of that, really. So,
do you know what? I'm gonna put it out there that I want a lot of our guys on the social media now to be doing a few Pilates moves.
I'm going to be watching. Yeah,
definitely. I can't wait to see that, by the way. Right. Now then, we've got a couple of our guys as well. For instance, Steve from Steve and Alex Bricklaying and Dean. Steve hasn't had his hip operation yet. Dean has, and I think he's been successful. He's now back at work. Is there we seem to be finding this a lot now with the joints, knee replacements, hip replacements. Do they just naturally get worn out? Is there a way to save them and to put less pressure on them?
So it's like car parts, really. You know, any joint, any hip, knee, whatever replacement, it's got a lifespan on it. You know, it's a mechanical part, and like any part of any machinery, it's going to wear down. So we generally, the orthopaedic surgeons who do these operations generally give a lifespan of about 10 to 15 years on a new joint. So they try and push it back as far as they can because they don't want to be going in replacing it if they can help it. But inevitably, sometimes people do need to have a further one further down the line. The second operation is always a little bit more tricky because you've got scar tissue there, etc. So that's why they try and push it out. But you know, again, it's the same principle. It's those repetitive movements. You know, people listening to this will be working on sites and with equipment and all sorts where they're avoiding repetitive use of bits of equipment, bits of things that they work. I mean, I'm not a builder, as you can tell, but you know, it's the same principle for your body. If you're constantly using the same piece of equipment day in, day out and doing the same movement on it, it's going to wear out quicker. Yeah. So it's just that same principle of, you know, keeping moving generally.
I think generally Steve's going through the pain barrier though at the minute because it keeps getting put back and put back.
It's awful. It's really, since COVID as well, it's been a nightmare trying to get joints replaced. It's just really desperate times for people.
So we've got, the next one is Sean told us he's concerned about damaging his eyes with his PPE glasses. Dust is getting in there as well. And we've also got a painter called Peter who's having to have an eye operation because one of his tear ducts got blocked from dust. Again, I think I could probably answer one of those questions myself, and that is, with PPE, particularly with your goggles and your glasses and that sort of thing, we don't replace them often enough. And they carry a lot of dirt and dust anyway. But again, is there a way of prevention? If his tear duct got blocked with dust, I mean, it's amazing when you think about it. But that's the environment we're in.
It's fine though, dust, isn't it? The dust that you're working with is so tight. Often you can't even see it. I bet it's just blocking things up that you don't even know. Yeah. You don't know it's happening until it's happened, kind of thing. I think if you know you're working in dusty environments, obviously wearing your goggles and PP is the first thing. But then, you know, there's no harm in doing eye baths at night. You know, you can buy these
that's a good shout.
Plastic eye baths, And even if it's just say you can buy Saline on Amazon, I've just bought some for my son actually because he plays water polo with no goggles and he plays every day and he gets loads of chlorine in his eyes. And you just
so that
eye
dries
baths.
up his eyes as
yeah,
well.
Yeah, and then they start stinging and they're watering a lot. And actually, they're watering because they're trying to flush out the chlorine. And the same thing with the dust. So patients will often say to me, well, why do I need to wash them out? Because they're watering all the time. They're watering because they're trying to get rid of the rubbish out of your eyes. You know, if you actually clean them out, they'll stop all that watering and irritation.
Yeah, I think the reason Peter found out that his tear duct was blocked was because he was watching an emotional movie, and when he cried, his tears rolled down his back. So he was struggling.
Now that should be in the papers, not on a waiting list for an operation.
Exactly. Now then, there's also 8 or 9 tradespeople we've got here: Richard Wagner, John Argyle, Kevin Page, and a few more, who stated their concern about conditions related to building dust. How much of a concern is that from a health perspective, do you feel? Because
it's huge.
You know yourself that if you have builders in the property, because we get this from time to time, where your client will say, "Oh, there won't be any dust, will there?" and of course there's going to be dust. Of course there is.
Yeah.
But it's how to prevent that.
Yeah, do you know, it does really worry me this. I've had workmen in over the last couple of years and I actually asked one if he was going to wear a mask. You know, I bet he thought I was a complete idiot, like why is she interfering? But it's so harmful, the dust getting into your lungs and you know, I get if it's your job day in, day out, you become complacent with things, don't you? You don't think about, you know, it's just normal for you. But the amount, it was a plasterer actually, he was doing some plastering and the amount of dust that was, he was basically white from head to toe and he didn't have a mask on or anything.
And imagine that, all that's on the external of the body, there'll be equal amount has actually gone into your lungs.
Yeah.
And sometimes I worry when I was watching somebody the other day who was doing some paving and they were pouring out some cement to put the paving down. And the plumes of that cement dust is horrible. It really is horrible. And they had no PPE on at all. I wanted to stop the car and go, guys, what are you doing to yourselves?
It's like they're just not thinking, I think, about the fact that you're actually shortening your life significantly. And it's like anything, isn't it? You think it's not going to happen to you. You think you know you're invincible. These things don't happen until they happen. Yeah. And then it's irreversible. And you know, you just before you know it, you're in a really dire place.
Yeah. Now this is a tricky one. Again, I'm sorry about this, ladies, but these are for geezers on this occasion. We've got Jed, who's concerned about prostate and checking his prostate. Okay.
Yeah.
Now, this is, again, something that we should be doing all the time because there's tests for breast, you know, for lumps on your breast and stuff like that that the women do. But when it comes to blokes who have got to inspect the dangly bits, it's a little bit like they're concerned about how they do it. So even though I'd love to bring a model in so we can show it.
Yeah, there's not much to demo on,
so there's not much to demo on. But how do they? Will, my producer, says he's not doing it. But how do you test? Is there a tried and tested way if you're concerned?
So it's a little bit controversial, the whole prostate testing thing, because there is no national screening programme for prostate screening. So you can have breast screening where you go and have a scan. We do cervical screening where you have a smear, bowel screening. But there's no national programme for prostate testing. There is a prostate test we can do. There's a blood test called PSA, but we don't routinely call men forwards for that. There's been some pilots done on certain groups of men that have been brought forwards to have a PSA test. The reason for that is that sometimes we get false positives for this blood test. So that means that people have the blood test and it's high and actually they haven't got cancer, it's a false high, but they end up going through lots of different investigations and some of them can be quite invasive, biopsies and things in the prostate, which is quite, not very pleasant. So we're not encouraged to routinely screen people. And you can't feel your own prostate unless you Inspector Gadget. Your prostate is up your back passage and quite high up, so your GP may examine for that.
Yes.
So the key is knowing the symptoms about your prostate, the reason why we would be concerned. So if you are suddenly changing the way you go for a pee. So if you're going for a pee and you can't start your flow, or you're struggling to stop your flow, so you've got some dribble after it.
Okay, we're going to take this stage by stage.
Go on.
Right. So if you're struggling to begin to have a pee, right?
So if you think, I need a pee, I'm going to the loo, oh God, it's not coming out, I really need a pee, but it's not coming out, that's a warning sign.
Okay. I hope you're making notes.
Next one, if you go for a pee and your flow isn't like it should be, so if normally like you just go for a pee, but it comes out and you finish, if it's like sort of trickling out or feels like there's just no stream there, that's another warning sign.
Okay.
Yeah.
Notes,
so
please.
Poor flow. Next one is if you stop peeing, you think, right, I've finished now, but you're still dribbling, you can't stop it. That's another one.
Okay. So this is all about being brave now, because I'm telling you, there'll be people that are listening to this and watching this, and they'll be going, that's me.
Yeah.
What's the next move?
The next move is you need to go and tell your GP. This doesn't mean, I don't want people panicking, this doesn't mean you've got cancer.
No,
it might mean your prostate's just got a little bit large.
Yeah.
Then that's normal. That happens with age. Everybody's prostate will grow with age. And sometimes when it grows, the problem with the prostate is it's wrapped around your wee pipe, your urethra. So as it gets bigger, it constricts it.
Right.
That's exactly. So it's like so for the plumbers listening.
Yeah.
I'm not a plumber, but I always describe it like plumbing.
I'd love to see you plumbing.
You really wouldn't. You'd have to put your swimming trunks on. It just constricts it, so the wee's not getting out. So all those symptoms we've described, poor flow, not able to get it out, feeling like you have to push your wee out, or not being able to stop once it starts. It's just a blockage in the system because the prostate's got big. And most of the time it will just be an enlarged prostate, and there's medications we can use for that. We can give you medications that will shrink it, that will relax it and help that peeing again. But a few times, and this is the bit that we really need to be careful of, it can be a sign of a tumour in the prostate that's pressing on that wee pipe, and that means that we need to treat that. And the sooner we get to that, there's treatment you can have. Sooner we get to it, sooner we find it, the better the outlook for that.
Yeah, it's important. I want to cover this. This isn't a question that's been asked, but the other thing as well is things even like erectile dysfunction, that type of thing as well.
Yeah.
When it's happening to people, to the guys, again, they hide behind the mask. They don't want to know about it. Is it something that a GP is open to somebody coming in and going, Doc,
100%. Yeah. Do you know? I don't know if you have it on my Insta. I posted a bit ago about what your GP's probably not thinking today. Your GP's not sat there thinking, God, I hope nobody comes in with erectile dysfunction. I hope nobody comes in with a prostate problem. Patients come in and they apologise. I'm really sorry, Doc. I'm really sorry to bring you this problem. Don't apologise. Don't be embarrassed. This is my job. This is what I deal with every day in, day out. I do not bat an eyelid about this. Like, I won't even flinch. If you come in and tell me, I've got erectile dysfunction, or, I'm struggling to pee, when I pee I can't stop, I will not bat an eyelid. If I have to examine you, I'm not embarrassed. And I think the patient's often worried that they're embarrassing us, and you're really not.
Yeah.
We want you to come and tell us about these, because 9 times out of 10, the earlier we find things, we can treat them, we can get you back on the road, get you back to work. If you leave it, things just get worse.
Yeah, exactly that. And it can affect their mental well-being as well, which is another thing that's really important.
Yeah.
I just want to make it clear, right? These are things we're talking about that we wouldn't normally be talking about. I'm getting that, right? But it's important. There will be people out there who are suffering in silence, and the doc is here to explain it's fine. Come in and see the doc and tell all. It'll be such a weight off his shoulders as well.
And it's confidential. We're not going to start having a word or telling the receptionist who you see in Morrison's on a Tuesday. We're not going to do any of that.
Erectile dysfunction. No.
It's all
you're
confidential.
Not do that. Yeah.
If I bump into you, I bump into loads of my patients because I work and live on the same patch, which I really like. I like being in the community. But, I do bump into patients at the schoolyard, at Morrison's. I'm not going to start asking, how's that problem, or I'm not even going to give it a second thought. I'm too busy usually wrestling a child off the floor, or, looking for, don't even give it a second thought.
Wrestling a child.
Yeah. So and she's 16. So
that's definitely not part of your Pilates. Right. So we have talked a lot about blokes today, but Jen, who's a decorator, has said her back is her biggest issue, and her doctor has just told her to get a new job. Surely there's a better solution than that. And we've also heard concerns about hearing after working with such high levels of noise that hearing is being affected, tinnitus, etc., etc. Again, that goes back to PPE. So let's just take this one at a time.
Okay.
Let's take Jen and her back. Now, in real terms, when you look at a decorator, they're usually on a hop-up or they're on a ladder or they're reaching back or whatever. Again, how does Jen... I mean, we don't want Jen... We haven't got enough women in our industry anyway.
It's a bit rubbish to say get another job, isn't it?
Get another job.
I know, that's
there has
not
to be
ideal.
another way. So is there anything like back supports or things she can do to strengthen her back?
Do you know, I think physio, I know a lot of people roll their eyes these days when I say physio because they think, oh God, it's just a fob off. But, you know, a good physio can really get you back on the road again. And it is all about strengthening the other muscles so that they can support the back better. I mean, I don't know what problems Jen's got, whether she's had scans, whether she's got disc problems. So it's a bit vague, you know, it's a bit difficult to give specific advice. But, you know, if it's mechanical back pain, then strengthening the other muscles using topical things like heat rubs and anti-inflammatories can really help.
Yeah.
But I would speak to the GP again about some physio, or if you're able to
choose a different GP.
Yeah, and if you're able to, and not everybody is, you know, seek physio. There's lots of physios that you don't have to go through the NHS for, but I appreciate that can be costly.
Yeah.
But sometimes can be well worth investment.
Now, because we're running out of time, I just want to talk about noise and the fact that we're in an industry, although a lot of machinery now is not as noisy as it used to be years ago. But again, we're exposing our hearing all the time to this constant cacophony in the background of, you know, chop saws going off, drills going off, pneumatics going off all over the place. And again, this is something I worry about when I'm on site, and I look at some of the guys and I think, wow, you're under that constant strain. Your hearing is, and you know, we talk about tinnitus. It's something to do with the hairs in your ears. What they're called? There's a specific name for them.
Yeah, I can't remember.
And no,
that's
normally,
good, isn't it?
Yeah,
that's a GP for you.
and they start to sort of curl away.
Yes.
And this is what causes the sort of the constant ringing or rush.
It really debilitates people. You know, people can't sleep. They can't concentrate on anything. I've seen grown men in tears in my room with tinnitus. I think it's underestimated how severe it can be. Yeah. And the best way again is prevention. It's keeping your ear protection. You know, not taking risks with your ears really, and I think people do take a lot of risks because they think again it's not going to happen to them.
I know, and because if the summer comes, they've got these headphones on, they've got the ear defenders on, and they're thinking it's just horrible, it's all sweaty. But do you know what? Protecting your ears and protecting your eyes are so critical. It's really, really important.
You'll be glad of it later on, definitely.
Definitely. Helen, look, there's loads of us who've got loads more questions that we could have fitted in today. So hopefully we'll be able to do a reprise.
Yeah,
and
we'll see how this one lands first,
shall
we?
To do more. I'm sure...
I might have scared everybody off with Pilates and prostates.
Listen, the thing is this, we're educating at the same time. And I think if they've got a partner that already does Pilates, and all they are then doing is probably sitting down watching the box, take a trip to Pilates, give it one little go. Yeah. You know, and you never know.
You'd be surprised how many men are there, actually. I've started doing a bit of it, and, you know, there are men there. There are men there, and I was, rightly or wrongly, I was surprised how many men were there. Yeah.
Well, we can turn that around now. So good to see a load of builders coming off site. We're having Pilates, lads. Right. Listen, Helen, it's been great speaking to you. Thank you so much for the work that you do. You do a brilliant job. Just remind people how they can find you.
I'm on Instagram. It's at Dr. Helen Wall, or the long word doctor.
The doctor has seen us now. Ladies and gentlemen, please put your hands together for Dr. Helen Wall.
Thank you.